to reward people who work under those circumstances. Now, back 40 years ago, they created the Underserviced Area Program, and that was a wonderful thing in those days. It really helped the small rural communities and the northern communities. But that program hasn't shown any significant change since then, and is now really of little value. The recent negotiation between the OMA and the Ministry of Health, for the first time, had nothing in it for rural doctors. And the Ontario Hospital Association is endorsing what's happening, even though half their hospitals are at risk of losing their emergency departments under the standards that have been set in the Niagara area. So it's as if rural has fallen off the radar screen. And again, I'm puzzled. I don't understand that. Rural doctors are a bargain. You know, we provide the same sort of care that is provided in the big city by a team of specialists, a very expensive team of specialists. And we save the system money every time we admit someone to our hospitals. And our nurses are a bargain. The whole team is a bargain financially. Our nurses get paid 75 cents an hour more to work a night or a weekend. To me, that's disgraceful. Hydro workers certainly wouldn't go out and work for 75 cents an hour more. How can we expect nurses in Seaforth to work at night for 75? I don't know whether that's the situation in Seaforth, but I do know it's a situation in Barry's Bay. So the answer is to keep these hospitals open and reward the staff, the nurses, the doctors, the whole crew, because we are providing high quality care at low cost. Finally, I'm going to talk for a few minutes about the effect on patients. And I want to make one thing very, very clear. There is absolutely no evidence anywhere to say that the quality of care provided in small hospitals, you know, the type of care that we provide, is in any way deficient or inferior, despite what some people have been saying over the past while. I have spent many hours reviewing the literature, and I have spoke to some very authoritative people who also have, you know, reputations, and that evidence just does not exist. I'm sorry. I'm not referring to cardiac surgery and aneurysm surgery and neurosurgery. I mean, of course, that stuff has to be done in the larger centers of excellence. But I'm talking about a type of medicine that the large factory city hospital just can't provide. It is the small hospital that is the center of excellence for the elderly and for those requiring palliative care. This is because, and you all know this, because of the proximity to family, friends, and familiar surroundings. It's because of familiar faces of staff who they get to see each day. The staff doesn't change every day like it does in the big city. It's because of doctors who they've known most of their lives, who know their case in intimate detail. It's because small hospitals deliver a medicine or a tonic that the large hospitals can never hope to provide. I refer in the case of the elderly to something called the will to live. And every doctor, every rural doctor has seen our patients go to the big city and languish and suddenly come back to our own hospital and pick up. In the case of the palliative patients, it's called death with dignity. Close to their home, close to their family, close to their friends. And I would also suggest there are many others who benefit from care close to home. Those with mental health issues, addiction problems, sexual abuse, those on dialysis, which can be provided in small hospitals. I know that because it's provided in our tiny little hospital in Barry's Bay. And chemotherapy, which should be provided close to home rather than forcing people to sit in the car and drive miles while they're feeling nauseated and weak. What about the emergency department? Dr. Kitts in Niagara says that if you're going to have an emergency department, you need CAT scanners and specialists. Well, this is at odds with the recommendations of the Canadian Association of Emergency Physicians and Accreditation Canada. With Dr. Kitts' recommendations, we can immediately close over half the emergency departments in this province. I already told you about my own personal experience. And I can tell you that every rural doctor who works in the emergency department can tell you many other stories along those lines. It's true, the percentage of really critically ill people in our emergency departments is small, as it is in most emergency departments. But you know, our society goes to great lengths to try and make sure that people are protected. And we spend a lot of money. We spent a lot of money looking after what happened in Walkerton, which really was a tragedy, but it involved a relatively small number of people in the whole scope of things. The same thing with the listeriosis outbreak. I put it to you that the number of patients saved in small emergency departments is far greater than Walkerton or the listeriosis and a lot of other things that we put a lot of money into preventing. What about substituting ambulances and paramedics for the emergency department in small towns? Again, I speak with personal experience. There can be no comparison between trying to look after someone in the back of a van that's moving along a highway on the one hand and providing that same care in a spacious emergency department with a team of providers, with a pharmacy with lots of drugs to choose from, with blood products, blood transfusions when needed. How can anyone compare those two things? That golden first hour after trauma is critical, and that cannot be provided in the back of an ambulance. Add to the equation traffic jams, weather conditions, hitting deer en route, which happened to our ambulance last week, insufficient numbers of ambulances, expensive helicopters that don't fly when we need them the most, and again, I can speak to that, and the conclusion is obvious. The closure of small emergency hospitals, emergency departments, will result in preventable deaths to people in Ontario. Ladies and gentlemen, the stakes are high. I urge you to fight this one in every possible way. You are up against a very clever, gradual, quiet rollout of a plan to change healthcare delivery in Ontario. It's being pushed by planners who have no real knowledge of the clinical aspects of what they're recommending, nor the economic effects on communities. It's pushed by experts from large academic centers who have no knowledge of rural health, or providing rural health care, or the unique skills required to administer a small hospital. It's being pushed without any evidence to support their decisions, either from a healthcare quality perspective or from a financial efficiency perspective. And it is sad that in the same way it's taking years to correct the physician shortage, if this goes ahead, it will take years to correct the decisions now being made. This is not a spark in the forest. This is a raging campfire in the forest, and we have to put it out quickly. Thank you.
Thank you very much, Dr.